to laugh a little. But I don't think you want to hear them. I did graduate from Beth Israel Hospital in 1936 at the age of 19. And I got a wonderful training there. Of course, we didn't have the equipment that you have now. You know, we didn't have disposable needles and we didn't have disposable syringes. We sterilized everything, and we made our own cotton balls and wrapped them and put them in the autoclave. And and there was the doctors, when all else failed, they irrigated. We irrigated everything. We irrigated the eyes, the ears, the bladder. We irrigated. I don't know what good it did, but it certainly gave us a lot of work, and it was very good. It's true. Nursing has made many advances. But I was a patient 2 years ago, and I think that nursing has declined in some areas. And that's the hands-on, which is so important to patients. Just recognizing a patient and just acknowledging them. I know the nurses that took care of me 2 years ago and gave me transfusion. I think all they were interested in is my arm. They didn't turn around to look at me or say hello or do anything. And it's disheartening when people don't have the time, and that's what it is, time, to say hello and how are you and what are you, how are you feeling and what can I help, how can I help you? It's true there are nurses' aides that have taken over the nursing duties, but they, unfortunately, my complaint is they are not getting the proper education on how to treat a patient in a lot of hospitals. I know that White Plains is doing a marvelous job of trying to introduce different language of how to speak to a patient. And words can be so important, because I think the biggest thing in nursing is HOPE. And if you can give people hope that they will get better, that there is a future, that they will get out of the hospital, that they'll walk out of there, I think that's so necessary, and as far as I'm concerned, as far as my own experience is concerned. Well, I'm going to just give you a brief history. I did work at, my first job was at Kings County Hospital. And I went to work there because they paid $90 a month. And my hospital only paid $85. So I went to work there, and it was quite an experience. It was very, very hard work. I worked on the medical ward at night, and they had 26 patients and one nurse and one orderly. And we didn't have drug addiction, as I said before, but what we did have was alcoholism. And there were quite a few alcoholics on the ward every night. And we also had a lot of pneumonia. And at that time, they put the patients in oxygen tents. I don't know if you've seen any of those around. I don't think so. But it was quite a job to rush around, give people medication, give them change their gowns with the pneumonia, and just generally care, let them survive the night. That's all I prayed for, that they would survive the night.
Did you live in the hospital then?
No, I lived in a furnished room, actually. And I have to tell you about that. I was, as I said, quite young, and I moved to Brooklyn and got a room with some woman in a furnished room. And the first thing she did was put a padlock on the phone. And I thought to myself, I don't know a soul in Brooklyn. I don't know who she expects to call. But I moved out of there pretty fast. Well, I don't want to make this too lengthy. You've been listening to a lot of talk. But the next hospital I went to after that was Willard Parker Hospital. And I'm ashamed to say I went there because they paid more. They paid $95. You may think that's not a lot, but that was a lot then. Yeah, I'm sure it was. And I thought that was the most educating experience for me, because that was a hospital for communicable diseases, and we had at that time, we didn't have the penicillin, we didn't have the treatments that they have now. We had a lot of measles, which we're getting back again. I heard that there were 50 cases recently in Minnesota, and we had diphtheria, scarlet fever, whooping cough, mumps, polio, you name it.
Tuberculosis.
But we also had TB. There was a whole building devoted to TB, and this was Willard Parker Hospital was on 15th Street and the East River, and they would come off the boat, people would come off the boat straight into the people with leprosy. But the TB hospital, I know there are people who work with TB now. We kept the patients on the wards for weeks at a time. And we didn't have nurses' aides. We just nurses that they had. And one of our jobs we had was to collect the sputum cups and wrap them in newspapers and bring them down somewhere. I think it's we looked it up on the internet. It must have been a metal can where they were taking to incinerators to be burned. Because I began to wonder, what did we do with all that waste? And that's what was done at that time. And the nurses were constantly exposed to the sputum, and it wasn't unusual for several nurses to come down with TB. In fact, I came down with a skin lesion on my elbow. I didn't even know there was such a thing as TB of the skin, but I did get that. But the other experiences in the other section, there were a lot of tracheotomies with the diphtheria patients, and which was very hard for the nurses to care for. And let's see, the measles was also, the children were very sick, so we owe a lot to immunization and the advances that were made in that direction, I must say. I also was given the opportunity there to ride the ambulance, and I wanted to tell you that at that time, hospitals were divided into different specialties. Ours was communicable disease, but there was a hospital in Brooklyn called Kingston Avenue Hospital that all the venereal disease went to Kingston Avenue Hospital. And I got the opportunity, which I loved, to ride the ambulance. And all we did was go to the various sexually transmitted disease clinics, pick up the prostitutes, and bring them to Kingston Avenue. Well, one day I picked up these 3 prostitutes, and they were sitting in the back of the car with me, and they looked at me, and I was all of 20 years old, and they said, "You're a nurse. It's so disgusting." And I want you to know I had a straight face. But because of my experience at Willard Parker Hospital, which was so varied with all the children's diseases, after that I was able to get a plum job in foster care, which I loved very much. And I'm going to make it short and sweet. And then I got married and retired, but then went back to work when Debbie was 5 years old. And I went back to White Plains Hospital, and then I worked at New Rochelle Hospital for 27 years doing surgical nursing, which is my love, because I love people coming in, having something cut out and sent home. That's my favorite. But then I got tired hanging around. So at 84, I decided to do per diem. And I went to an agency and went to different doctors' offices. Didn't know a damn thing about it. Okay, you know, or anything like that. And I faked it, you know. I gave me the money, I took it.
It's a riot.
And I wanted to get a job with an ophthalmologist near my home, and I worked for him for 8 years until I was 92. And the irony is that I've lost my vision. And so I'm legally blind. But if anybody wants to offer me a job, questions I can answer.
Want to do some mental health screenings? I got a job for you.
Mental health.
Pardon me? I said I still have my hearing, but not great.
I said you want to do some mental health screenings?
Mental health screenings.
Mental health screening?
Yeah.
Ask her how much.
That's right. It depends on the price.
$95 a day.
But you know, the prices didn't go up that much. When I worked at White Plains, I worked about 6 hours. I worked 9 to 3, so I could be home for the children. And I only got $25 at that time.
Oh my God. Feel better now.
But that was in Debbie was 63. I mean, she was 5. 1959, 1960. It was a small hospital at that time. Yeah. But the prices just went up recently, you know, but so our costs, and you know, as far as housing and food is very high now. So nurses are paid accordingly. But I think I think that hospitals should do more to teach people how to approach a patient and reassure them, and there should be more of what the old-fashioned nursing of hands-on. I think you'll agree with me. I hope you agree with me.
Absolutely.
I think people have their heads in the computers too much.
Absolutely.
You walk into a doctor's office, they don't even greet you. They're constantly looking at the computer. Well, look, I made this speech short so you can all go home.